Getting ready for patient care this morning. Not sure if you saw earlier this week, I had a hip injury after Army 10 miler. I didn't really notice anything until after. Saw my hip surgeon, diagnosed with a labral tear, just a tiny bit of impingement, which means the bones, and that's probably why the labral tear occurred, is a little extra bony overgrowth. And I've been running since middle school, and it happens. Saw my surgeon yesterday to look at the MRI, and he's like, okay, labral tear, great. Whereas the surgery I had 18 years ago, same surgeon, I was like limping, having so much pain, really, really different scenario, had a lot more impingement as I recall. So we're just going to kind of rehab this. And what people don't realize is before I was a pelvic floor physical therapist, I started my career basically in orthopedics. And it's really interesting paying attention to rehabbing this hip this time around, because last time I was like primarily an orthopedic therapist that kind of did some pelvic floor on the side. But again, 18 years ago, we didn't really have that very clear connection between the pelvic floor and the hip. Whereas now, like, we've got plenty of data saying, hey, there's something going on here. And when I have patients that have pelvic floor issues, which is everybody, one of my first questions is, have you had any issues with your hip pain? And of course, most moms and most runners have navigated hip pain in some way, shape, or form. And so this has really been, I wouldn't say nice, like having hip pain isn't nice, but it's been a nice reminder to go back and get myself updated in kind of the hip literature a little bit more, because we've come a long way. Like back when I had my labral surgery 18 years ago, I had labral debridement. They were just starting to do scopes. And I had a microfracture and treatment for the FAI. And again, we weren't looking at the pelvic floor at that point. So for me now, yes, I'm paying attention to my hip symptoms and kind of calming that down, but I'm also paying attention to my pelvic floor symptoms. And if I go back to after Army, when my hip started to kick up a little bit and I wasn't quite sure what was going on, I was having some leakage that kind of came out of nowhere. On runs when previous to that, it had been good. And I was like, oh, maybe it's, I haven't been as great with my vaginal estrogen, this or that. No, it very much was a pissed off hip and a high tone pelvic floor. And since my hip has calmed down, my pelvic floor is better. So this all goes to say, if you are somebody navigating pelvic floor issues, and somebody hasn't asked you about your hip, you need to, if you've had hip issues, sometimes that's the treatment for the pelvic floor issues. You got to go to the why. So I always love it when people DM me and they're like, oh, I have leakage. How do I fix it? And I'm like, okay, that's like this huge question. Do you have this? And so in my case, I could clearly take it back now in the rear view and be like, yeah, when this started to kick up and my hip was really pissed off, all of a sudden I had leakage that I totally blamed on other things and then tried to narrow that down. And then now it's very, very clear that that's what's going on. And as my hip has become more calm and less irritable, and less need for muscles to be kind of guarding and tight, and my range of motion is much better, my symptoms are gone. So big picture, always look at other stuff. Look at poop, look at hip, look at back, look at all these other things. Because lots of times the pelvic floor is the one that's like, it's screaming. It's the one you pay attention to, because the other one's kind of like, but yeah, so we're probably going to have a little bit more hip kind of integrative content going forward, because that's where my head is. And the really nice thing about this too is I have my, for my board certification for women's health and orthopedics, every 3 years we have to do an update to keep our board certification. And so I need to make sure I have all my continuing education and up to date for all of that. So yeah, more hip stuff. But if you have hip questions or navigating pelvic floor and hip issues, definitely hop in the DMs. If you're navigating labral tears or post-labral surgeries, definitely let me know if you're treating that and you're like, this is not a great place for me or space for me. Or if you're an orthopedic therapist and you notice pelvic floor issues and vice versa, and you're not well-versed in treating them, happy to kind of help you navigate that piece. But long story short, if you have pelvic floor issues, we need to clear out the hip. And if you're having hip issues, make sure that there's not other pelvic floor things going on. So, as fun as you can have a learning journey while navigating hip pain, I'm looking forward to this. Again, totally different scenario. I can run, I can lift. There's just a couple little things that are a little tweaky. So that's why I think I'm so positive about this, because it was not that scenario for me 18 years ago. So I'm kind of excited. So definitely pop your questions in. I'm looking forward to answering those.